If you are living with lupus, or you love someone who is, I need the next 18 minutes of your life. Because what you put on your plate 3 times a day is either quietly fueling your next flare-up or helping your immune system finally stand down. And most lupus patients I have worked with have never been told this. You know the reality of living with lupus. The fatigue that hits before noon and does not lift. The joint pain that makes you question every movement. The brain fog that makes a simple conversation feel like wading through concrete. And the flares unpredictable, exhausting, sometimes terrifying that remind you, this disease is not going anywhere. I am a clinical nutritionist, and in over 15 years of practice, I have worked with hundreds of patients managing autoimmune conditions. Lupus is one where I have seen diet make a genuinely life-changing difference. Not a cure, not magic, but a real, measurable, biological difference, and I am going to show you exactly how. By the end of this video, you will have a simple, beginner-friendly, Mediterranean-style eating plan designed specifically around lupus management, and you will understand exactly why it works at a biological level. Stay with me, because what comes next changes everything about how you think about food and this disease. One study found lupus patients following an anti-inflammatory dietary pattern reported up to 50% fewer flare days. That number stopped me when I first read it. I will break down what the research actually says in a moment, but first, here is what we are covering today. We are going to talk about what lupus does inside your body, why the Mediterranean diet targets those exact mechanisms, which foods to prioritize, which ones to remove, and I will give you a full beginner meal framework you can start this week. Let us get into it. Lupus is a systemic autoimmune disease. That means your immune system, the system designed to protect you, becomes confused and starts attacking your own healthy tissue. Depending on the person, it can affect the skin, joints, kidneys, heart, lungs, and brain. It is why lupus looks so different from patient to patient and why it is so difficult to manage. At the core of almost every lupus symptom is chronic, uncontrolled inflammation. And here is what most people do not realize. The foods you eat every single day can either pour gasoline on that inflammatory fire or help put it out. Think about it. When was the last time anyone sat down with you and explained the connection between your fork and your flares? Let me make this concrete. In lupus, the immune system overproduces pro-inflammatory signaling molecules called cytokines, specifically IL-6 and TNF-alpha. These cytokines drive tissue damage, pain, and fatigue. At the same time, lupus patients show significantly elevated oxidative stress, essentially cellular damage from unstable molecules, called free radicals. And increasingly, research is linking gut microbiome dysbiosis, an imbalance in the gut bacterial community, to autoimmune flare activity. Here is the analogy I use with my patients. Think of your immune system like an overly sensitive smoke detector. In lupus, it is going off constantly, even when there is no real fire. Certain foods turn up the sensitivity. Others help recalibrate the sensor. Now here is where it gets interesting. In my practice, I have seen patients reduce their CRP, that is C-reactive protein, a key blood marker of inflammation, by measurable amounts within 8 to 12 weeks of dietary change alone. Not eliminate their medications, not reverse the diagnosis, but genuinely move the needle on inflammation levels and feel it in their daily lives. That is the power we are talking about today. So, what exactly is the Mediterranean-style diet? I use the word style deliberately because we are adapting the foundational principles of this eating pattern specifically to support lupus management, not just general heart health. This dietary pattern comes from the traditional eating habits of populations bordering the Mediterranean Sea, Greece, Italy, Spain, southern France, Turkey, and parts of North Africa. In the 1960s, researcher Ansel Keys noticed these populations had dramatically lower rates of heart disease and chronic illness compared to industrialized Western nations. Decades of rigorous research since then have confirmed the anti-inflammatory, immune-modulating power of this way of eating. The core pillars are straightforward. First, abundant plant foods, vegetables, fruits, legumes, whole grains, nuts, and seeds. Second, healthy fats, with extra virgin olive oil as the primary fat source. Third, regular fish and seafood, especially fatty fish. Fourth, moderate amounts of poultry, eggs, and dairy. Fifth, very limited red meat and processed foods. And sixth, herbs and spices over salt for flavoring. Simple in structure, powerful in effect. One of my patients, a 8-year-old woman, diagnosed with lupus 4 years before she came to see me, arrived exhausted and deeply frustrated. She was doing everything her rheumatologist recommended. Medications were on board, but her fatigue was relentless, and she felt like she had no control over her own body. Within 10 weeks of shifting to a Mediterranean-style approach, she told me her energy levels felt like they had come back from the dead. Her words, not mine. I will come back to her story later, because the ending matters. But that is not even the most shocking part. What she experienced was not a placebo. There are specific biological mechanisms explaining exactly why this works for lupus, and I want you to understand them, because knowledge is what makes a new habit stick. Mechanism number 1 is omega-3 fatty acids and inflammation suppression. Fatty fish salmon, mackerel, sardines, anchovies are loaded with EPA and DHA, 2 types of long-chain omega-3 fatty acids. These work by competing with arachidonic acid in your cellular membranes to produce less inflammatory signaling molecules called prostaglandins and leukotrienes. Less of those molecules means a dampened inflammatory response. Multiple studies, including research published in the journal Lupus, show omega-3 intake both through diet and supplementation can measurably reduce disease activity scores in lupus patients. This is not speculative, this is biochemistry. Mechanism number 2 is antioxidants and oxidative stress reduction. Lupus patients have significantly higher levels of oxidative stress than the general population. This oxidative damage to cell membranes and DNA can actually trigger immune activation and worsen flares. The Mediterranean diet is extraordinarily rich in antioxidants, vitamin C from tomatoes and citrus, vitamin E from olive oil and nuts, polyphenols from berries and extra virgin olive oil, carotenoids from colorful vegetables. These compounds help neutralize the free radicals driving that cellular damage. And if you are eating a typical Western diet right now, processed foods, refined sugars, very few vegetables, you are getting almost none of these protective compounds. Mechanism number 3 is gut microbiome support and immune regulation. This is the mechanism most lupus patients never hear about, and it is fascinating. Approximately 70% of your immune system lives in and around your gut in the gut-associated lymphoid tissue. Research is increasingly linking gut microbiome imbalance, called dysbiosis, to autoimmune flares, including in lupus. The Mediterranean diet is one of the most well-studied dietary patterns for supporting microbiome diversity through its high-fiber content from legumes, vegetables, and whole grains, and its inclusion of fermented foods like natural yogurt and aged cheese. So when you eat Mediterranean style, you are not just eating healthy in a vague general sense. You are targeting the exact biological mechanisms that drive lupus symptoms. That is the distinction that matters. Now I want to give you what I call the lupus Mediterranean power foods, your go-to staples that should form the backbone of your weekly eating. Fatty fish, salmon, sardines, mackerel, anchovies. Aim for at least 3 servings per week. These are your most powerful, natural anti-inflammatories. If you are not a regular fish eater, this is the one area I strongly encourage you to experiment with preparation methods. Baked salmon with lemon, garlic, and fresh herbs takes 20 minutes and genuinely tastes exceptional. Extra virgin olive oil. This is your primary cooking and finishing fat. Replace all other oils with this. It contains a compound called oleocanthal that works similarly to ibuprofen in its anti-inflammatory action. Use it generously on roasted vegetables, in dressings, drizzled over fish and legumes. Leafy greens, spinach, kale, arugula, Swiss chard, rich in folate, vitamin K, and antioxidants. Important note for lupus patients on warfarin. Discuss consistency of vitamin K intake with your doctor rather than avoiding leafy greens entirely. Consistency, not elimination. Colorful vegetables, bell peppers, tomatoes, zucchini, eggplant, beets. Each color represents different antioxidant and phytochemical compounds. Aim for the rainbow every single day. This is not a decorative suggestion, it is biochemically meaningful. Legumes, lentils, chickpeas, black beans, kidney beans. Exceptional fiber source for gut health, plant protein, and anti-inflammatory minerals including magnesium and zinc. Affordable, versatile, and incredibly convenient from a can. Berries, blueberries, strawberries, pomegranate. Among the highest antioxidant foods on the planet. Blueberries specifically contain anthocyanins that have shown immune-modulating effects in published research. Add them to breakfast daily. Turmeric and ginger. Not strictly Mediterranean, but they integrate beautifully into this eating style and have well-documented anti-inflammatory properties. Curcumin and turmeric specifically pair it with black pepper to increase absorption by up to 2,000%. That is not a typo. Walnuts and almonds. Rich in omega-3 fatty acids, vitamin E, and magnesium. A small handful daily as a snack is one of the easiest wins in this entire plan. Now I want to talk about the foods that commonly make lupus worse. And I want to be clear, this is not about creating fear or restriction for its own sake. This is about understanding that certain foods have measurable pro-inflammatory effects. Ultra-processed foods and refined sugars are the biggest drivers of systemic inflammation. Packaged snacks, fast food, sugary beverages, white bread, pastries, these spike blood sugar rapidly, promote inflammatory cytokine production, and disrupt gut bacteria. In Mediterranean eating, these simply have no place. Red meat and processed meats. More than 2 servings of red meat per week, and especially processed meats like sausage, bacon, and deli meats, have been associated with increased lupus disease activity in observational studies. Reduce these significantly. Alfalfa sprouts. This one is lupus-specific and critical. Alfalfa contains an amino acid called L-cannabinine, which has been shown to stimulate immune activity and potentially trigger lupus flares. Avoid these entirely, not occasionally, entirely. Excessive sodium. High sodium intake is particularly concerning for lupus patients with kidney involvement. Many processed foods are loaded with hidden sodium. Cooking from scratch using herbs and spices gives you control over what goes into your body. Alcohol. Alcohol is pro-inflammatory, can interact with lupus medications including hydroxychloroquine and methotrexate, and stresses the liver. If you choose to consume it, keep it minimal and discuss with your rheumatologist. High-dose garlic supplements. Small culinary amounts used in cooking are generally fine and actually beneficial. But supplemental high-dose garlic has immune-stimulating properties that may be counterproductive in an already overactivated immune system. And if you are thinking this does not apply to you because you eat reasonably well, take a closer look at sodium content in your packaged foods this week. Most people are genuinely shocked. Clinical note I always give my patients. Every person with lupus is different. Some have specific food sensitivities, medication interactions, or organ involvement that requires individualized guidance. Always work in collaboration with your rheumatologist and consider connecting with a registered dietitian who specializes in autoimmune conditions. All right, this is where everything becomes practical. I am going to give you a simple, repeatable beginner meal framework. You do not need to be a chef. You do not need expensive ingredients. You need a structure you can actually follow. The plate method for lupus Mediterranean eating is this. Half your plate is colorful, non-starchy vegetables roasted, raw, sautéed in olive oil, or in soups and stews. A quarter of your plate is quality protein, fatty fish, legumes, poultry, or eggs. The remaining quarter is whole grains or starchy vegetables, brown rice, quinoa, farro, or sweet potato. Finish with a drizzle of extra virgin olive oil and fresh herbs or lemon for flavor. That is your template. Let me walk you through 3 days of real meals. Day 1. Breakfast. Greek yogurt with blueberries, walnuts, and a small drizzle of honey. Lunch. A large salad with arugula, cherry tomatoes, cucumber, chickpeas, olives, and feta, dressed with lemon and olive oil. Dinner. Baked salmon with roasted bell peppers and zucchini over quinoa. Snack. A handful of almonds and an apple. Day 2. Breakfast. 2 scrambled eggs with sautéed spinach and tomatoes cooked in olive oil, 1 slice of whole grain toast. Lunch, lentil soup with a piece of whole grain bread and olive oil. Dinner, grilled chicken thighs with a Mediterranean tomato and olive sauce over brown rice. Snack, hummus with sliced cucumber and carrot sticks. Day 3, breakfast, overnight oats with chia seeds, fresh strawberries, and almond butter. Lunch, tuna salad dressed with olive oil rather than mayonnaise, served in a whole grain pita with tomato and lettuce. Dinner, shrimp sautéed in olive oil with garlic, cherry tomatoes, and spinach over whole wheat pasta. Snack, a small piece of dark chocolate at 70% cocoa or higher with a few walnuts. Practical tips for getting started. Batch cook legumes and grains on Sunday so they are ready throughout the week. Keep canned sardines and canned chickpeas in your pantry. They are legitimate Mediterranean meals in emergencies. Invest in 1 good bottle of quality extra virgin olive oil. Frozen wild salmon and frozen berries are just as nutritious as fresh and significantly more affordable. Now, I want to spend a few minutes on important nuances because lupus is not one size fits all. The vitamin D and sunlight paradox. Many lupus patients are vitamin D deficient, partly because sun exposure, which stimulates vitamin D production in the skin, can trigger flares in photosensitive individuals. Your dietary sources become especially important. Fatty fish, egg yolks, fortified dairy. Discuss vitamin D supplementation with your doctor. In my experience, most rheumatologists now recommend supplementation for lupus patients as standard practice. If you have lupus nephritis, kidney involvement, protein intake, potassium, and phosphorus may need specific management. Fatty fish is generally still appropriate, but work with a nephrologist or renal dietitian for personalized guidance. Do not try to navigate kidney disease through general nutrition advice alone. Medication interactions matter. If you are on hydroxychloroquine, this dietary approach is highly compatible. If you are on corticosteroids like prednisone, be aware these medications can drive blood sugar spikes, reducing refined carbohydrates and sugars, which the Mediterranean diet naturally does, becomes even more critical. If you are taking methotrexate, ensure adequate folate intake from leafy greens and legumes and discuss supplemental folate with your doctor. And managing fatigue while cooking, because I hear this constantly. When you are exhausted, a complex recipe is not realistic. Here is the honest answer. A can of sardines, some olives, cherry tomatoes, and whole grain crackers is a fully legitimate Mediterranean meal. A bag of pre-washed salad greens with canned chickpeas and olive oil takes 4 minutes. Batch cooking when you feel well means you have food available when you do not. Build your system around your energy, not around perfection. I want to be completely honest with you about what dietary change can and cannot do for lupus. This is not a cure. The Mediterranean diet will not replace your rheumatologist or your medications. But here is what I have witnessed consistently across 15 years of clinical practice. Patients who adopt an anti-inflammatory dietary approach alongside their medical treatment tend to have fewer and less severe flares, better and more consistent energy, improved mood and cognitive clarity, reduced cardiovascular risk, which is a serious and often underappreciated concern for lupus patients. And often, over time, some are able to work with their doctors to revisit and potentially adjust medication needs. Remember the patient I mentioned at the beginning, the 8-year-old whose energy felt like it had come back from the dead? 6 months after we started working together, she sent me a message. She said, "I went to my last rheumatology appointment, and my doctor asked what I had changed. My CRP was down. My fatigue scores were measurably better. And for the first time since my diagnosis, I felt like I had some control over my own body." That is what this is about. Not perfection, not miracle cures. Control, consistency, and giving your body the best possible environment to manage this disease. I'll reveal the exact timeline you can realistically expect in a moment, but first know this. Most of my patients notice meaningful changes in energy and digestive comfort within 2 to 4 weeks. Measurable changes in inflammation markers typically appear between 8 and 16 weeks of consistent eating. Give it time, and be genuinely patient with yourself on hard days. One difficult day does not erase weeks of progress. Health disclaimer. The information in this video is for educational purposes only and is not intended as medical advice. Always consult your rheumatologist, physician, or a registered dietitian before making significant changes to your diet, especially if you are managing active lupus, kidney involvement, or are on prescription medications. Let me leave you with the 5 things I want you to take away from today. 1. Lupus is driven by chronic inflammation, and the Mediterranean diet directly targets the exact biological mechanisms behind it. 2. Your power foods are fatty fish, extra virgin olive oil, colorful vegetables, berries, legumes, and leafy greens. 3. Your foods to limit are ultra-processed foods, refined sugars, processed meats, alfalfa sprouts, and excess sodium. 4. The beginner plate is simple. Half vegetables, quarter quality protein, quarter whole grains, olive oil as your fat. 5. This works best as part of your complete lupus management strategy, not as a replacement for medical care. This week, I want you to do one thing, just one. Pick one Mediterranean meal from what we covered today and make it happen. 1 baked salmon dinner, 1 lentil soup, 1 Greek yogurt and blueberry breakfast. Start there. Momentum builds from small, consistent actions, not from overhauling everything overnight. If you found this helpful, please share it with someone in your life who is managing lupus or another autoimmune condition. And drop a comment below. Tell me, what is your biggest challenge when it comes to eating well with lupus? I read every comment, and I regularly create follow-up videos based on exactly what you share. If you want more evidence-based nutrition guidance for autoimmune health and chronic conditions, subscribe to Active Healthcare. We publish new videos every week. Your health journey deserves support at every single step.